Hello, everybody.
Good morning,
Good morning from Dr. Din and
Laura.
Laura,
The joker for today.
the Joker. She is. We celebrate Halloween pretty much every week during this beautiful month, and Laura especially is very fond of turning into different things. Today she's starting with.
The Joker in honor of the Joker movie coming out. But I am the Joker.
What's the inspiration?
Jared Leto as the Joker.
Oh,
That's him because I find him very hot.
really?
And I was very, very, very turned on by him in the Suicide Squad. So this is my rendition of it.
Oh, wow.
Yeah, you got to see it.
I
It's
know,
good.
we got scared when we opened the door in the morning. Like, what happened? Oh. Here I am trying to be like a fall princess.
Yes,
And she's
yes.
like, okay, yeah. So we had a great, I went for a very nice hike up in Vermont. It was like amazing. I showed you the
You
pictures.
did amazing.
So such a great, and the colors, the way everything in nature ages, and every year the leaves turn all the colors in that part. And I had been planning to go there for the past like so many years, and I never could. I always miss the leaf season, the leaf peeping
Yeah.
season. I would always, for some reason, miss it. I never really intended to go and just check out that. And I was able to do that this weekend, and I'm like so happy.
Yeah, it's beautiful. Your pictures were amazing.
I know, I am going to post them.
Yay. But I have something amazing to share.
Wow.
The hardcover of Do We Really Need Botox?
I know.
Very
yeah,
exciting.
it came out really beautiful. I was like
Yeah.
very, very amazed at the way
Beautiful.
it turned out. And so the hardcover is very special because we're taking it out for the holiday season. And we will be putting, I think, a gift certificate in it. It's going to be a coupon for like $100 off
That's
of any
amazing.
services. So basically, if you support the nonprofit foundation for single mothers, which is and you purchase this book as a gift for somebody, they will be able to use it, our coupon towards any service. So it will make a great gift idea.
And, right, it's going to a good cause.
Oh, absolutely,
So
absolutely.
I think
yeah.
that's a great thing.
Yes.
So if nothing else,
Yes.
you've done a
Yes.
great service
Yes,
by
no,
purchasing it.
I know. Thank you, and thank you. I really appreciate it. We are all set and getting ready to launch the book on December 12th. So watch out for that. We also, I want that most of our book stuff should be done, like the Audible should be out and everything. Before we launch it, so
great.
this I think end of this month we're also trying to do the Audible. So that being said, because nobody like who has the time to sit and read anymore? Most people, like I listen to so much Audible
Do you?
and stuff because it's lives are so
Easier.
busy. I like to read with the book also, but I have like partial dyslexia, so I prefer like the Audible version of thing because I read so slow. But if I really have to learn things like about my own stuff, then I definitely make sure that I not only hear it but also read it in several ways. So I am totally interested in putting the book out in all kinds of versions
think
so
that's
that it
great.
helps people. And again, this is not a book about just Botox. It is a book about anti-aging, all the things that we have to do to age in a healthy way. Again, the book is not called "Do You Want Botox?" It's basically, does human body need to have Botox for anti-aging purposes. And one of the things that really are amazing about Botox is that this is the only virus or the only product that we know that once we inject it into any part of your body, like your forehead and stuff where it's allowed, it actually reverses the signs of aging within 5 to 6 days.
So question that I have is for the middle-aged, perimenopause, menopausal female that's going through mental, emotional, physical, because I feel like I am experiencing a little perimenopause, and it's taking a lot of work for me mentally to help myself not feel sad and all those
Depressed,
emotions.
yes.
Yeah, so to me, if I never had Botox and I came to you and said, how would Botox help me emotionally? What would it do for me to get through
Yeah.
this period?
Yeah, so see, every human is different, and we get to know what is it that's bothering you. Basically, we're not trying to impose our views on anybody else, but what I like to do is that most just have like a interview with men and women about what is bothering. Most of the people are like worried about the way aging starts hitting them around our age,
Yeah.
and they're like, oh wow, I mean, there is progressive change, and suddenly the change starts happening faster because your body's losing some of the hormones that we depend on for collagen synthesis, for keeping our skin moist and moisturized. So at a certain point, women start noticing the changes happening in their skin, even if they're eating well and sleeping well and everything. It's just the way our bodies are made. And at that point, studies and research show that as you are declining in bodily function, certain symptoms start happening, which are basically directly related to your body aging. Where, for example, you start getting body aches and pains. Women start experiencing sleep disturbances, and also mood and emotional lability, and we start becoming sometimes temperamental and stuff, which is normal because of hormonal changes. And many times after menopause has occurred, like in their like early 50s or like middle 50s, that's when many women can start feeling overwhelmed by the aging process if they have not done anything about it in their 40s or 30s. And that's when they seek help. Many at that point are referred to therapists and psychiatrists, and that's where they end up being started on medications like antidepressants. And guess what? Antidepressants are covered by insurance. And, but Wellbutrin that you would use for your depression is no less cheaper than Botox, because 3 months of Wellbutrin will also cost the healthcare industry the same amount. I sometimes refer to Botox as like as if it is a vaccine against aging of your face. Because imagine if you're like, we do get a flu shot, and all right, it may not help 100% of the people, but it does end up saving a lot of people from catching the flu. So similarly for aging also, Botox is like not everything, but again, if you read my book, I do mention that body is composed of your emotional factors, your physical factors, and also how how you're surrounded, your environmental factors. They all come together when anti-aging is done. So similarly, Botox is a part of anti-aging services. So yes, you have to eat well, you have to sleep better, you have to to maintain your body, because your body is like a very, very complicated machine. And even the doctors, like we who have studied all kinds of physiologic symptoms and systems and all the diseases, even the doctors don't really understand the body as in its amazing and intricate details. So it's good for human beings to keep our minds open. There's so much research being done. Not only we have to replenish our systems orally and by eating the right foods, but also at some point we would be giving vitamins and stuff which will help replenish. We're just making people live so much longer now because of like great healthcare and stuff, that it is just very important for people to also not start feeling old when they're 55, because they're going to live for another 30 or 40 years. So it makes sense to anti-age, because you'll just be productive much longer. Because the thing is that, we're not worried about death, because death is eventually, we have not conquered death. We are all on a collision course with death. But the thing is that what makes a lot of people scared is not really death per se, but the 10 years of illness or sickness that you experience before you die. And or like in some cases it's like 20 years of illness and sickness, and they're just unproductive and they're living in nursing homes, and that is something that a lot of people try to avoid. So sexual dysfunction is a very, very important part of as we were discussing before. One of the aging symptoms of aging is that you stop having sex, and that is a very, very common problem which happens with women. And that is one of the reasons that at Giovanni we also offer stuff for your sex life, where we try to help you in whatever way we can.
So perimenopause female comes in and she's expressing to you, I'm losing my desire for sex. Mm-hmm. How would you treat it? What would be...
So again, everything starts with blood work. So we definitely check all your hormonal levels. We want to know if you've had gynecological exams and everything. And then we go into detail. Many times perimenopause just causes a lot of dryness. And sometimes a very small replacement of a topical estrogen can, like something like estraze or stuff, can really improve the symptoms. But then there are like people who should not be using estrogen, and for them they have like plant-based products which also can help with the loss of moisture. So that is that happens. We also do, as after normal childbirth, sometimes women lose the elasticity of their vaginal walls, and we do offer vaginal rejuvenation products and services also. And again, that is something that we first have to make sure that you don't have any other problems going on before we get to that. So everything has a process. So the human body is not just the face. It's not just your pelvic system. It's not just it's also how you perceive yourself and how the function is happening every day. To the point where now they have research which says that if you are feeling very lonely, or if you do not have good friends with whom you connect at a very deeper level, and if your connections are not good, you may not experience life as well as you would want to. So again, to just live well, these things have become very important. And Western medicine is now catching up to a lot of other things. So as a doctor, we were not trained in med school about the importance of telling people how to meditate, or how to control their stress, and how to mind and body connection. But I think it is very important to learn all these things, and now we are figuring out.
But Eastern medicine is, I think, filtering more into our...
It's all research that is now... there were so many skeptics who would view all of these things that, wow, I mean, it's not in my anatomy book or my physiology book, then most likely this is not true. But again, now we're finding out that a lot of those things were indeed correct and did help people. But again, research is now happening very, very quickly. And now also because of great computational services and robots and AI, we can really go through data very quickly. So that's why a lot of research is happening so quickly, and it takes such a long time to really, every 2 days or 3 days, there is so much more new stuff that it's really exciting to be alive in this era where things are happening so quickly, and also to be able to help people, because now I can actually see that how when somebody comes, how we can very effectively help them live their lives according to their own choices.
So it's not vanity, and I think a lot of people do look at it in a vain way, and they feel like, oh, I'm going to do Botox, I'm going to do this, like, they get this feeling about it. Or if they tell people that they're doing these services, there's a lot of negativity surrounding fillers and Botox, and I think that that's awful, because it's not, I mean,
no, it's not awful. It is very normal. It's a normal human reaction whenever something new happens. A lot of people tend to be skeptical about the usage. Botox is a very new thing. The cosmetic uses of Botox were just discovered 20 years ago. So that is one of the reasons that people are not that much inclined to be open about it. But that is changing very quickly. There are almost over 1 billion users of Botox or such similar products around the world, and the rest of the world is wondering if it is right or not. So it's not, and these perceptions will change because of just the fact that we are just living longer. Right. And one of the things is that there is a misconception. This is not about vanity, because if you treat, because we have been taking aging as like a natural thing, whereas aging should be considered like a disease, like any other disease. So how is it any different than diabetes or hypertension? If you develop diabetes or hypertension, till the last day of your death, you're popping pill to stay alive. Similarly, aging is also a disease, and the symptoms that you face while you're aging, currently they may not be covered by insurance because FDA does not consider aging a disease, but that will change because they will have no other choice but to change that entire process of thinking. And that's what my book is about. Also, it's not about do we want Botox, it's like I need it. It is like an like, to, as far as I'm concerned, and I have a lot of clients, as you know, in my office, and by the grace of God, it's only because our prices are so good and we're so good. But aside from that, the reason is that I feel that many of the people who come to us regularly for Botox, they're coming to get immunized against aging. Mm-hmm. They're like, it's like an immunization. It lasts in your body for like 2 to 3 months, and then you have to do it again. Yes, it's a pain in the neck to keep doing it again and again, but guess what? They are coming out with products which are like Botox, which are now going to last and give you that immunity against aging for a much longer time.
And men as well. I mean, your male clientele is very large. So absolutely, men are doing it too, and I think that's great.
And it's not vanity. One of the things is that if you are looking after yourself, you are taking care of your own body. Your body, one of the chapters in the book is also that your body is not your temple. It's a car that you can't get out of.
Maintenance.
Yeah, so the day you get out of this body, you'll die. So to take care of your body is more important than taking care of your house or your car, because those things, if God forbid something happens, you go and you can get another one.
Correct.
But something happens to your body, you can't get another one. And maintaining it and taking care of it. If I tell people, if your car gets like a big dent in the middle of its headlights, I am sure that you're going to, at some point in a year or 2 years or 3 months, you'll go and get it
Yes.
fixed. But if you get like a wrinkle right here, which is etched in your in the middle of your eyes, you think it's not impacting your own brain? Your brain, our brains, and this is also again research now. Our brains have different algorithms, and our own brains views itself.
So as you look at yourself aging, it sends a message
Yes.
to your body
Yes.
that says we're aging.
Yes.
So then you start aging faster, right?
Again, and that is so good. What you're saying, what exactly
Your
you
reflection.
said. This is epigenetics. What you're saying, this is the epigenetics thesis and theory, which is being presented now. Which says that if we look at ourselves and we feel, our brain senses that yes, this is it, you're now beginning to look like your father or your grandfather or something, then automatically your brain starts producing signs and symptoms of aging which are related with that kind of a self-image. And that is just an epigenetic thing. So yes, at a cellular level, different things start happening.
So you just want to feel good. I got it. Can I pull it out?
Yes, but that is my, yes. Did you pull out my hair?
I did.
She broke my hair.
I can fix it because I'm a hair doctor. You're a skin
All right.
doctor.
Perfect. So thank you so much for watching. And if you have any questions or suggestions for us to improve our program, please write to us. Also share our video. Also subscribe to our YouTube channel because we will be posting so much stuff over there and a lot of relevant stuff over there.
Absolutely.
So I can't wait to see you guys next Tuesday, and have a great week, guys. See you soon. Bye-bye.
Bye.